I'm Dr. Michael DeTola.
And I'm Megan Strong.
In today's case of the week, a dentist is penny wise, pound foolish. She's robbing Peter to pay Paul. A day short and a dollar late, and other expressions my dad used to say.
Okay, wow. And in the news, a grandma gives us 102 reasons to take care of our teeth.
And want to play the Chairside Live game? Decide right now which state eats the most sugar and write it down. Don't cheat and wait for the news. That and more on today's Chairside Live. Hey now, hello and welcome to episode 137 of Chairside Live. We've got a good episode for you today. Megan, how's it going at home?
It's going well. Eden is sleeping better. She's over her sickness, and so that means I'm sleeping better, needing less coffee. So it's going well.
You're living the American dream as you're working from home primarily, right?
Yes, I am, except for Wednesdays when we come in and film the show. I work from home while Eden is watched by one of her grandparents, and it's awesome.
I always, I started to take it personally because you always get so excited to see me, but I forget that it's some of your only adult interaction outside of the house. So first I thought, wow, Megan really misses me all week, and then I realized, no, she's just happy that I don't spit up on her shoulder or need to be changed.
Well, every once in a while you do. So how are you doing? What's going on?
Good. We've been working on something, a friend and I. We have a secret surprise.
What?
But it rhymes with rodcast. So a friend and I, who's a dentist, have made a podcast. We can't announce it just yet because we're waiting for iTunes to approve it.
Okay.
Because frankly, it's filthy. No, it's not filthy. It's part dentistry. It's part little sports, little this, little that.
All
just
right.
what's going on in two dentists' lives as we talk back and forth and discuss all kinds of things.
Nice.
The whole world. So it's.
Well, tell us when it's out because I want to listen to it.
I will. Hopefully, it'll be next week that iTunes will approve it, and we'll be able to get it out to everybody. Because unlike this, which is fantastic, because you get to see us,
right,
and you get to hear us, and you get to see cases like they'll see a little later on in the case of the week. This is difficult to watch in your car, and frankly, not completely safe to watch in your car. Because if you're like me and you're opening mail anyway or texting, you shouldn't be watching something at the same time. That'll be the new law in California. Just one other thing besides driving that you can do. But this, an audio podcast that Josh and I are doing, this will be something that everybody can listen to on the way to and from work. And so it'll be a little more portable, perhaps, than Chairside Live itself. Maybe the audio companion would be a good way to think about it. So on today's episode, we've got an interesting case of the week that actually kind of steps on one of my pet peeves. There's something that dentists do that bothers me, and I admit I don't have to do this because I practice inside the lab, but it's about sending impressions from the other side of the country and the best way to do that. So let's go ahead and take a look at that case now. On today's case of the week, I want to talk about alginate replacement materials, but we're going to back into that by kind of a circuitous route. The thing that inspired this was me just kind of looking at this case that was sitting down in the fixed department, and two impressions are in, one labeled A, one labeled B. And on the RX, it says, please fabricate Bruxer solid zirconia bridge number 2, 3, and 4. Use impression A, which I think is funny. So why send impression B? Just adding to the confusion, but okay. Sent both of them, but use impression A. Ignore impression B. And the shade is a C2, which probably means it's wrong. No, it's probably not wrong. It could be right. But anyway, we got two polyvinyl impressions here. The one where they ran out of material or tried to save a little on the other side is the one to be used. But the thing that bothers me every time I see a case like this is when the opposing model comes in the form of an alginate impression. Now, this was poured up yesterday, so this is a day even older than it was before, but it was already starting to shrink away from the tray. This doctor's on the other side of the country, and it had to be sent to Newport Beach. So it happens on cases like this where we're doing large crown and bridge, and then we have alginate impressions across from it for the opposing model, because this model's not going to be nearly as accurate as this. In fact, it's just flat out inaccurate most of the time. Even if it's wrapped in a wet paper towel and all that good stuff, it's still inaccurate. The bite's never going to be right on this bridge when it's all said and done. But besides that is a number of impressions that we get for occlusal guards that are taken with alginate, snoring appliances taken with alginate, play-safe mouth guards taken with alginate, wrapped in a paper towel and sent to us. And there's always some distortion. It's not always quite as bad as this because this has already been poured and then had another day of dehydration. But I do want to make a case for using alginate replacement materials today, and an easier way to kind of do it. So what I want to do is introduce you to a tray you may not have seen before. This is the Alpha tray from Premier Dental, and this is a full upper, full lower tray for taking full mouth impressions. This is my assistant filling. You can see the tray, and she's being filled by my assistant. You can see she didn't bleed it quite enough. You can see the purple on the distal part of that where it should have been bled a little bit more. But again, it comes in 3 sizes, small, medium, and large. It's got those T-locks that Premier has to help lock the impression material into the tray. You can see it along the inside of the facial rim there. And so she's filling it. This happens to be Position Penta from 3M SB. And you place it like it was a maxillary impression and seat it all the way onto the upper teeth, clear the frenum, and then have them bite into that. And you can see that in a couple of minutes, you get an impression on the upper and lower that's very clean, almost the detail of a crown and bridge impression material, because these are polyvinyl siloxanes. They're not as expensive as a regular crown and bridge one, but it looks very nice. We capture a lot of detail, very comfortable for the patient, because unlike a typical upper impression where they have to hold open, this is a closed mouth impression. You seat it on the upper, they bite together, so you get a pretty good indication of the bite as well. You usually don't have to take a separate bite registration because we can hand articulate these models. And you end up with a comfortable patient who's got their teeth all the way together, and so they don't feel like they're gagging, having to hold their mouth open a little bit. And it takes me back even to bite registrations, because we're still going to get to those alginate replacements, but I still want to make one more point about alginate models. This is the bite registration that I was taught to do in dental school, this kind of horseshoe wax. It never quite fits the way it should on the model, just doesn't look great. We get a lot of bite registrations like the one on the right where it's untrimmed, and you can see that it's going in and out of edentulous areas, and because of that, and because it's in contact with some soft tissue there as well, it's not going to fit down onto that model as well. And so the picture on the left shows it being trimmed, something we have to do, but something you can do as well by just using less bite registration material so it doesn't have to be trimmed. You can see on the left using it to get a prep, and we're getting just most of the occlusal half of the prep and just the occlusal third of the opposing teeth, and that's fine. But look how accurate that bite on the left fits. And then when you take it to a model where a polyvinyl impression is taken on the lower, but an alginate impression on the top, you can see the resulting stone model from the alginate impression doesn't fit all that precisely into the bite registration. And that's because this polyvinyl siloxane bite registration is so much more accurate in terms of detail than the alginate is. In fact, look at this. This is a polyvinyl bite registration on the left of the second molar that you see, and that was taken and poured up in alginate. And you can see all the detail on the bite registration on the left, all the anatomy there. And then when you look at the model on the right that was taken with alginate and poured up, you don't see any of that. And it becomes clear why this polyvinyl bite registration that's so accurate is not going to fit onto that model. It simply won't seat all the way. And so for our doctors who like taking alginate impressions, here's what we have them do. We have them take what we call a lateral bite, because you pick up so much detail with a polyvinyl impression that there's simply no way that it's going to fit into the occlusal grooves if you take an alginate for the opposing. So patient bites all the way together. You can see us squirting the bite registration on the lateral aspects of the teeth. And then we take an alginate impression for that upper opposing, and you can see now we've got that model poured in white stone from the alginate. And because all we're picking up with this bite registration is the buccal surfaces of the teeth and the buccal embrasures, now this fits in there pretty well. But if we would have taken a regular bite registration, we would have picked up all the grooves, the deep grooves and anatomy on the natural teeth, and there's no way that would have ever fit onto this stone model. So using an alginate impression is fine for an opposing, but you have to pour it in your own office, and you should be taking lateral bites like this, because otherwise we have to start grinding out the bite registration. Then it's really not any good at all. That picture that just popped up there is of an alginate replacement, and you can see how well it fits the bite registration because it's a polyvinyl just like the alginate replacement, and it fits very well between those teeth, because when we use an alginate replacement for the opposing arch or for a snoring appliance or for a bite guard, we're going to get something that fits really well. So just a couple of brands of these if you're not familiar with the alginate replacements. This is Silginat from Kettenbach. This is Status Blue from DMG America. That's the first one that I started using. We still use this a lot. You can see it's available in regular cartridges and for the MixStar. The very first one ever was the Position Penta Quick, and it comes in the sausages. That's the one you saw my assistant using in that little video at the beginning. We go between a bunch of different ones of these just playing around. This is the Alginex Ultra, available in regular cartridges and to fit the Deca. This is from Dentsply. And Alginaut, still one of my nominations for the best name in dentistry because it's not alginate, so they named it Alginaut. That was the original. I've stopped using that in favor of Alginaut FS, the fast set, because the old Alginaut was great, but it did take a while to set, and it cut some time off on the FS. And I want to have, I'm not into working time all that much on these materials. I want to have it in the patient's mouth the least amount of time possible, whatever that happens to be. Counterfeit, that's another good name from Clinician's Choice up in Canada. I like that because it sounds, counterfeit is kind of a catchy name, and they're talking about the opposing model or the counter model fitting. Noginate, that's not bad from Danville in terms of naming. All these products, for whatever reason, seem to have some of the more creative names in dentistry. So as we look at this table, you can see a list of the characteristics and how long they take to set and how long before you can remove them from the mouth. They average about 2.5 minutes to be removed. You have about 1.25 minutes of working time. Some don't have any flavors. Some have flavors. I like the one, the unflavored. That's my favorite flavor from Silginent. Unflavored. The colors, I don't know if that matters to you or not. Probably what matters is the dispensing, whether or not it comes out of a cartridge or can be put in a mixing machine. And these are the prices up at the top for per ml for the original kit or for refill cartridges or for the sausages that go in the mixing machine. And so you'll see the Position Penta Quick for the mixing machine is 15 cents per ml from 3MSB. That's a pretty value placed product for 3MSB, who sometimes tends to be a little bit towards the higher end of the price. Alginaut FS at 12 cents per ml there as well. But in the cartridges, you can see the Silginat from Kettenbach only 15 cents. So a couple different choices there. And if you're asking, well, how much are other impression materials? An average alginate material is 6 cents per milliliter, and the Alginaut FS that we saw happens to be 12 cents per milliliter. And then an average Crown and Bridge polyvinyl siloxane is about 40 cents per millimeter, to put it in perspective. And so going at 6 cents per milliliter with the alginate, yes, it's the cheapest way to do it, but it's also the least accurate, and it has the easily the highest chance of distorting if you're not pouring it yourself in the office. We're doubling the price, to go to Alginaut FS, but it's from 6 cents to 12 cents per milliliter. It's not that big of a deal, not that big of a step up to go to something like an alginate replacement that won't distort, doesn't need to be wrapped in a paper towel. We can pour it multiple times here in the laboratory if we need to. And when it comes to something like a 6-unit bridge, and we're going to take an opposing impression, you want the bite to be correct on that so you don't have to do a lot of adjustments. It's worth it doing the alginate replacement materials. And if you're going to seat a night guard, or you're going to seat a Silent Night or another obstructive sleep apnea appliance, it's really well worth it to use an alginate replacement material and give yourself a much better chance at having that appliance fit the first time.
Thank you for that, Dr. D.
You're welcome.
Now let's go to a segment we call Viewer Mail. This week's viewer mail comes to us from Boston from Dr. Siroha, and he says, Dear Dr. Datola, I have watched your Chairside Live videos since the very first one. I like how you make things practical and step by step. The videos make a lot of sense for so many changes in the last few years in dentistry, especially for zirconia crowns. Recently, you have talked several times about Tryon Cement, and I was wondering if you can tell me the brand and process of using it prior to cementation, cleanup, etc. Thank you, Dr. Siroha.
Well, that's a good question, and yeah, you're right. There have been a lot of changes, and most of the changes have been related to the growth of Emax and solid zirconia as restorative materials. Don't really use Tryon Cement for solid zirconia at all, mainly because, 99.9% of the restorations we do with it are crowns and bridges and not veneer. So Tryon Cement is really a necessity for veneers, such as Emax veneers, which is what I'm making all of my veneers from these days. And the Tryon Cement's there for a couple of reasons, but mainly to kind of hold the veneer in place so the patient can smile and look and it's not falling. And sometimes if we're using different shades of Tryon paste, it gives us an idea whether or not we're able to influence the final shade of the veneers by using a different shade of Tryon Cement underneath it. And so the two that I use most of the time are going to be Variolink Aesthetic from Ivoclar Vivadent and NX3 from Kerr. Now, both of these are light cured or dual cured resin cements. I only use the light cured version for porcelain veneers just to make sure we don't have any color shift, years down the road from the auto cure mechanisms that are in some of these cements. And on both of those, whether it's the Variolink Aesthetic or the NX3, both of those cements also come in with their own Tryon shades. And so I guess it seems pretty obvious, but key number one would be use the same Tryon shades for the cement that you're going to use to actually put the veneers in. Don't just have old Tryon cement laying around from an old system and try them in that way. They're water soluble, all of these different Tryon cements, so when you use them on the inside of the veneer, they can simply be rinsed out with a vigorous air water syringe or a steam cleaner. One of the things that I'm lucky enough to have here in the lab, we have them everywhere around the lab because all the technicians use these portable steam cleaners. I really don't see anybody selling them in dentistry, and I always thought it'd be a good side business to sell these steam cleaners to dentists because they do a great job of cleaning things out like Tryon Cement. They hook up to like a 5-gallon Sparklets bottle, but you just blast out this hot rush of steam. That's not pure steam. It's also got water with it too, and it does a great job of cleaning it out. But an air water syringe would work as well. There's really no need to sandblast or do anything else because those are water soluble. The hydrofluoric etching on the inside of an Emax veneer, for example, that was done by the laboratory, does not get contaminated by Tryon Cement. So you don't need to go back in on an Emax veneer, for example, and etch with hydrofluoric acid. And you don't need to go back in and apply silane again if the lab's already applied it, and just about every lab I know does. It won't hurt if you want to apply that again. You can clean the inside with phosphoric acid. Phosphoric acid, if you look at bond strength studies, will actually improve the bond of an Emax crown to the tooth via a resin cement if you clean the inside with phosphoric acid. But, unfortunately, phosphoric acid is awful for zirconia crowns, as we've covered many times, and so you have to keep that kind of distinction clear. Phosphoric acid's okay to clean up the inside of a veneer, but you can't use it on zirconia. You can use IvoClean on either one. IvoClean will also do a good job of cleaning that up. But at the very basic, you can literally just try it in with Tryon Cement, take it off when you're done, rinse it out with an air water syringe, dry it, and then go to your cement because it's already been hydrofluorically etched and had the silane placed by your laboratory. So that would be the minimum, and then you could go anywhere up from there. My biggest concern with Tryon Cements is that they tend to cover some flaws, for example, and I've been burned by this a couple times over the years, not so much recently because I figured out how to deal with it, but when you try in veneers with a Tryon Cement, they can look fantastic when the patient looks at it. And one of the reasons they might look fantastic is because the Tryon Cement's getting into the little gingival embrasures where there might be a slight opening. In other words, if you have some tiny little black triangles on your veneers because the patient's had some gingival recession over the decades, and that's just the way it is, unless you want to take the porcelain really subgingival to close that space and make the teeth rectangular, sometimes you'll have tiny little spaces, little black, not really a black triangle, but a black dot in that gingival embrasure. I've been burned before when Tryon Cement fills that up on the Tryon and we look at it and it looks great. Then we put the veneers on, cure it, clean up all the cement, and we have those little black triangles. And the patient says, what's that black space right here between 8 and 9? And that's when you have to make a decision. And mine was always to say, what black space? I'm just going to deny that it's actually there. If it's small enough, it'll fill with saliva so that you don't have to worry about it. The surface tension will hold that in there. But Tryon paste can cover up some of those, and you don't want to find out about it afterwards. So make sure when using Tryon paste that as you're cleaning it up around the edges that you take a piece, not of regular floss, but of like the Thornton 3-in-1 floss or the Thornton bridge and implant floss, the one that's got the little like caterpillar, looks like a soft pipe cleaner. Make sure you run those through the gingival embrasures and get the Tryon Cement out so you can see really what it's going to look like right there before you've actually bonded all those into place. Otherwise, Tryon Cement's a fantastic way to be able to put and hold them in. Bicuspids won't stay in at all, sometimes even with the Tryon paste in there. Don't make the mistake my dental assistant once made, where instead of using Tryon paste, she accidentally grabbed the real one and used it as Tryon paste. Then the patient wanted to go outside and see how it looked, and so they went outside and looked in the sun. And the sun, of course, is God's curing light, and so by the time they came back in 2.5 minutes later, it was cured on and had to be cut off, even though it looked perfect. So make sure you're using the Tryon cement that's matched for the permanent cement that you're using, and make sure it is, in fact, the Tryon cement. And do a really good job of cleaning it up when you show it to the patient, especially those gingival embrasures, because that's the one area where I've gotten burned before in the past. But otherwise, not much to know about it. Some come in a universal shade, a light and a dark, if you want to try to influence the final shade of the veneers. The veneers may or may not be translucent enough to show that. And frankly, when we take those cements and we put them between two glass slides and get down to about 50 microns, even a dark yellow cement turns translucent when you get it that thin. And that's the parameter that we set for these veneers when we're digitally designing them, as 50 microns of virtual dye space. So it's hard to tell if the shades are going to make a difference or not. But if you have more dye space or thinner veneers, it could help you out if you think you need to get a little lighter or a little lower in value. So thank you so much for that question and for asking that. And I'm happy to say we have a new old gift today.
Yay!
This is coming all the way to you, Doc. It's the 30-piece, not too challenging. I mean, just seriously, was this like a fourth grader?
You could do on your lunch break.
You could probably do it with your foot while you're prepping it too. That'd be fun. Let's put some Velcro on there and put some on his big toe. And you assemble this. This actually, we have something called the math test here at Glidewell. I don't know if dentists know about this, but when we go to hire an employee, Jim Glidewell's always believed you give him a 25-question math test. You have 2 minutes to complete it. It's very difficult to complete it all, but it tests your ability to think and go, oh, I should skip this hard one and come back to it and get all these easy ones. It's what every employee who works here has been required to do over the years, and it's proved to be a great way to screen employees, especially because English is not the first language of all of our employees, and so it takes that out of the question. This, for a dental office, you're hiring a new dental assistant. See how long it takes her to put the 30-piece Chairside Live puzzle together. If it's over 4 hours, I'm going to say look somewhere else. If it's under 10 seconds, they've been cheating and studying this picture.
That's right. So dual purpose, you can use it for fun on your break and then also use it as a test to screen your potential employees.
Sure, why not? I think that seems better than any kind of interview. So you're going to be lucky enough to get one of these, and we have some new Chairside Live giveaways coming soon. So we hope you enjoy the 30-piece puzzle piece. We don't want to insult your intelligence. It's just too expensive for the 500-piece one, to be perfully honest. We had a 2-piece one, too, but that stumped me for about an hour, and we thought that's too embarrassing if you don't get it right. You got any news today?
A woman celebrated her 102nd birthday with the traditional candlelit cake. When she went to blow out the candles, her dentures came out instead. After hearing that the video went viral, the woman said she is just happy that she's bringing joy to people around the world.
As fake as this seems, that can actually happen.
Oh, for sure. And she actually said in the story that when she was interviewed that she just didn't feel like putting her denture cement in that day.
The adhesive in there.
Yeah.
And that's the problem with dentures, is that they need denture adhesive.
Yeah, she just didn't feel like putting the glue in that day, so.
Yeah, dentures, they should fit better than that, though, is the point where they don't need the adhesive. It's hard to know how old they are. One of my mentors, Gordon Christensen, is just adamant about why aren't more dentists doing mini implants, and we make our own mini implants here, and that's the kind of case where 4 mini implants with some O-rings where the denture snaps on, and now she would maybe struggle a little bit to get it off, and when she went to blew the candles out, the dentures didn't come out. Now let me ask you this. Your grandmother, or let's say your husband's grandmother, blowing out the candles, dentures come out, there's ropey saliva on the dentures, lands on the cake. Are you eating the cake?
I might go to this, corner piece me.
It pretty much hit all of it in this scenario.
Okay, fine. Then I would graciously accept it and then sneak it to the family dog.
Who might even go, oof.
Right. Who might even be repulsed.
He might look at you and go, I've had a chance at eating those dentures, but the smell is not good. I'll eat her grandson's retainer all day long. But I'm not touching those dentures. I feel I'm glad she has a good sense of humor about it, but I think it's It seems like it would be super embarrassing to have things come out. I mean, you're around friends and family, I guess, but a couple mini implants put in there and do it. I hope that becomes the standard of treatment for dentures, mainly because I'm not very good at dentures. Okay. That's the only way I can keep mine in place.
But at 102, I think she's a little late to the game for that. But it is interesting. It's funny because she... when she spit out the thing, she just laughed in the video, and she just didn't care. It was just like, whatever. So it was cute, but yes.
I'm glad it went viral. I hope she makes some money from it.
Yep.
Anything else?
Yes. The Hershey Company conducted a study on the nation's candy eating habits and uncovered the sweet tooth capital of America, Utah. Utah buys sweet treats at the highest rate in the nation, almost double the U.S. average. What's the favorite? Twizzlers are especially popular. A marketing professor at BYU says that the high Mormon population, more than 60% of Utah's residents, contributes to the sugar buzz. Mormons typically abstain from alcohol, caffeine, and tobacco. Sugar is the only allowed indulgence, he says.
Speaking of Gordon Christensen, I'm going to have to ask him about that.
You know what's interesting is the man in this story, the professor, his last name is actually Christensen.
Yeah, there's a lot up there.
Yeah.
Yeah, you throw a rock, you'll hit a Christensen up there. It's a very common name in the valley, in the Utah Valley. It's weird, though, because, you know, the way you got to admire the structure of the religion, you know, keeping them away from alcohol and caffeine and tobacco. But this seems like to be... you know, kind of violate the basic tenet that's there.
Right.
Like, it's kind of like, well, look, I gave you these guidelines because I wanted you to treat your body like a temple, was the phrase that I always heard.
Yeah.
And then the sugar is kind of like, well, it's like you're getting the religion on a technicality. It's like, yeah, eat all the sugar you want, but you just can't have this, this, and this. And maybe it's the least harmful out of the four.
Right.
But I'm not sure. I mean, it's hard.
And it's also another thing that they were saying that the state of Utah has a population of children, of people under 18. It's like somewhere in the 30 percentile of the population versus other states. It's around like the low 20s. So obviously kids, you know, typically eat more candy than adults or whatever. So that could have something to do with the higher numbers seen in Utah of more kids, so more candy.
And I don't know, if they swapped caffeine for sugar, so they didn't eat any sugar, but they were allowed to have coffee. I don't know, that seems like it could.
Yeah. You know what's interesting, actually, it's a common misconception that they can't have caffeine. They are allowed to have caffeine. They just, their religion prohibits them from drinking hot beverages such as coffee or tea. So they can have, according to my Mormon friend, they can have like sodas and caffeine like that. They just cannot have hot coffee or hot tea.
Well, according to my Mormon friend, your Mormon friend's going to hell, first off. And my Mormon friend goes to Costco and buys caffeine-free Diet Coke to stay away from it. So I'm not sure. I mean, that's probably like the least of the sins to be able to do that. But I like that
I am sure they can have caffeine. But
you're sure they can have caffeine?
I'm sure. This Chairside Live has become a religion debate. But yes, they can.
All right, Utah peeps. We need you to
Let
write
us
in
know.
and settle this. And you know what? While you're doing that, you know what they have? Last time I was in Utah for the St. George Marathon, fry sauce. Do you have any idea what fry sauce is?
Yes, it's ketchup mixed with mayonnaise.
How do you know that?
Because I just know
You have
things.
a Mormon friend.
I have a Mormon friend.
No,
Did
but
I
it's
not
huge
tell
in
you that?
Utah. It's one of those
Yes.
very regional things where you have fry sauce. And I was like, fry sauce? I didn't know what it was. And I was like, that's good, but it does taste reminiscent of ketchup and mayonnaise. Somebody goes, well, that's exactly what it is.
Yeah, and also they have one of the state dishes is funeral potatoes. They call it that because they take it typically to funerals where it's like a potluck sort of situation, but it's these cheesy potatoes with this crispy, delicious, buttery goodness on top. I'm getting hungry just thinking about it.
Funeral potatoes, yum.
Yum!
Right.
Nothing like some death and butter.
Usually we serve that with cholera rice. Delicious. All right, well, all the dentists in Utah, write us some hate mail and tell us where we're wrong. We're dying to know.
Who's right?
Settle this once and for all. We'll get a bet going. We won't say what the stakes are, but we'll get a bet going and see who wins.
I like it.
All right, that about wraps it up for this edition of Chairside Live. On behalf of myself, Megan, the whole CSL crew, and everybody here at the lab, I want to thank you for your time and your continued commitment to quality dentistry.
We'll see you next time.
And you want to play the Chairside Live game? Discuss amongst you.
Just do whatever. Do whatever you want.
Oh, we should have a cow of the week. Just go on Google and find a cow.
Moo. I like how you make things practical and step by step. The video. Dude, what's going on? It's fine.
The Crown,
Start
the video,
over.
the book, the chipmunk, the cinder block.
It's a bird, it's a plane.
I'll eat her grandson's retainer all day long.